Ankle surgery. Total reconstruction of ankle. In the world of ankle surgery, particularly that of ankle implants, the technology is changing at a very rapid rate. If you scan the internet for information on ankle implants, artificial joints, you will get a very diversified opinion as to the long-term effectiveness of ankle implants. Total ankle arthroplasty has been performed over the last 40 years or so, and whenever a new technique or new materials were introduced, there seems to be an early air of enthusiasm soon to be followed by disappointment. The higher than normal failure rates for ankle implants can be attributed to the following. Poor patient selection, patients that are too young, meaning since the life expectancy of an ankle implant is 10 to 15 years, it could be assumed that the implant will eventually fail in a younger individual and the patient would be looking at another surgery sometime in the future. Additionally, since younger patients tend to be more active, they put more stress on the implant and generally do not do as well as the older population. An obese patient is another criteria that will expedite implant failure. For obvious reasons, if a patient is extremely overweight, this overstresses the ankle joint and the implant and increases the possibility for implant failure. Diabetics, simply because of the inherent lower extremity problems a poorly controlled diabetic exhibits, this too can lead to implant failure. Osteoporosis, or demineralization of bone. If the bone stock of the ankle and tibia bone are not adequate, at the very least, the implant is more likely to loosen up and then fail. Abnormal gait patterns in individuals who suffer from neurological disease such as Parkinson's disease or multiple sclerosis or other similar disease entities. Poor implant materials. Both the type of implant material and their design have led to problems with sustainability of the implant. Surgeon experience. Anyone performing this type of surgery should be adept at both the various types of ankle implants on the market, along with a great deal of experience implanting artificial joints. Ankle implant versus ankle fusion. Ankle fusion. Prior to the advent of ankle implants, the only real option in chronic ankle pain was to fuse the ankle joint. Conservative treatments that should be tried prior to ankle arthroplastic procedures include orthotics, AFO, or ankle foot orthosis, which is essentially a combination orthotic and ankle brace, physical therapy, cortisone injections, and ankle arthroscopy. Although ankle fusions generally work out well, there are inherent problems with this procedure. Because the ankle joint is fused, meaning there is no longer any motion within that joint, it tends to put excessive pressure on the adjacent joints, in particular the subtalar joint, which is the joint just below the ankle joint. Since normal gait is predicated on the ability of the ankle to bend, when this motion has been stunted, it has to change the gait pattern in the individual. The attraction to an ankle implant is the hope that the painful degenerated ankle joint can be replaced with an artificial joint which will allow the individual to return to some semblance of a normal lifestyle. This is particularly true of the younger, more active person. Studies comparing ankle fusions versus ankle implants have generally found that both groups function similarly when walking on flat surfaces. People who have had ankle implants tended to exhibit better functionality when going up and down stairs and ambulating on uneven surfaces. Read the full article at www.foot-pain-explained.com/ankle_surgery.html.